Hello Hillsdale, welcome to our new video series we are calling Hospital Rounds. In every hospital, doctors and nurses have to round on their patients to ensure timely care and keep their patients updated on their care plan and how it's going. So we are going to do the same thing where we keep you, our community, up to date and in the know on how things are going in the hospital, just like we have done in our live streams in the past. Today we are rounding on our surgery unit, and I am here with Director of Surgery, Lauren Schneider. Thank you so much for being here with us, Lauren.
Of course, very excited.
Yeah, so just briefly introduce yourself and the surgical unit to our community.
Sounds good. Well, my name is Lauren Schneider. I'm the Director of Surgical Services here at Hillsdale Hospital. I have been in the surgery department for, almost like 8 years now. So This is my home. I love it. We have a great team here. So in surgery, we do a whole array of different specialties. From general surgery, ortho, spine, vascular, podiatry. We have all of the things. So if you're looking for, any sort of surgical service, likely we provide it.
Absolutely. We do have it here. We're really excited to walk you through the surgery unit today. We're going to meet some different staff members. We're going to see some different spaces and equipment and give you a tour. So stay tuned.
So here we are in our preoperative area. This is the first step in surgery where you'll get started. Here, one of our nurses will check you in and make sure your consent signed, get you settled in, check vital signs. Here's where you'll also talk with the doctor first, and then anesthesia as well. So if we want to head this way, we can show you a bay where we would get you ready at.
Okay, sounds good. So this is where it starts. As a patient who's receiving surgery, they come in, they get changed, and then what happens?
Then from here, we will have your chart ready. We'll verify that all of your information is correct. Have you sign consent and then get changed. You can have 1 to 2 loved ones back here with you as well during the preoperative phase. So that's always really nice to have that support system there.
So I am here with Danielle now. She is one of our nurse anesthetists. She is with Challenge Anesthesia, which is our anesthesiology group that we work with. So Danielle, welcome, and please introduce yourself to our community.
All right. Hi, everybody. I'm Danielle. I'm one of the CRNAs here at Hillsdale Hospital, providing you the excellent care that we give. One of the teammates from the anesthesia department will meet you here. We'll talk to you, explain our anesthetic plan, go over your health history, and make sure that you haven't eaten anything, taken the correct meds.
Absolutely. And Danielle has actually taken care of my family members before, and she does a wonderful job. Your whole group does a wonderful job. So
Thank you.
What do you kind of say to patients when maybe they're feeling a little bit nervous, they're about to head into surgery?
I have that a lot. We do this every day, so this is very normal for us. And so we are very understanding that, people are very nervous coming in the hospital for any kind of procedure. So I just, try to take some time and really listen to them and, let them talk to me.
Absolutely.
And see what they need.
Now I am here with Leslie. She's one of our RNs in the surgery department. Welcome, Leslie. Can you please tell our audience a little bit about yourself?
My name is Leslie. I've worked at the hospital for 17 years. I've worked in several different departments. And I've been in the surgery department the last 2 years as a registered nurse.
And what is your role in the pre-op process? Before a patient heads into surgery, what do you do with them?
Before they come in, we go over a few things regarding like the consent, the H&P. We'll get their vital signs, get their IVs going, do any of the little things such as, maybe cleanse the surgical area.
Yeah, awesome. Yeah. So you are really an integral part of that process before the patient is in surgery and having the procedure done. You make sure that their care is all continuous, and I know that you play a big role in that comfort piece and making sure patients feel comfortable and ready and prepared. So thank you for everything that you're doing. Yeah.
Thank you.
Now we are back in the OR. I have my bunny suit on to stay sterile because we want to protect the OR from any germs or outside non-sterile things that might come in. So I'm here with Brittany. Brittany, please introduce yourself and tell us a little bit about what you do here.
Okay. My name is Brittany Schaefer, and I'm a circulating RN here at Hillsdale Hospital. I've been here for going on 12 years, but a circulating RN for 6. So as the circulator, you're going to bring the patient into the operating room, and you have to have your mask on, your hat on, laundered scrubs from the hospital. And this is OR2. So we will go ahead and get our masks on and
let's go in.
Show you what we do in here.
Here we are back in the OR. This is where the magic happens. And we're going to meet a few friends back here who take care of our patients during the surgical process. But first, tell us a little bit about the process in prepping this space and what goes into that before the surgery happens.
Yeah, so we have anesthesia. We have our scrub tech who will set up the surgical field, and the nurse usually, and of course the doctor. So anesthesia and the nurse will work together to assess the patient preoperatively, and once we're ready to come on back, we'll come back here. We will bring a stretcher right on up this way to the OR table, and we'll have them scoot over, or we can slide them over, and then the anesthesia provider will put them to sleep or give them some sedation. Once they're asleep, we will then prep them and position them however we need for the surgery. This, for example, is like if we were doing an ankle surgery, this would go underneath their leg and their foot would be up here and it would be accessible to get to put the drapes and things on. For example, on this side, we have foam that we would tuck your arms with to the side to protect you. So we have a lot of padding and a lot of different positioning things that we use that once you're asleep, you're not aware that we do.
Yeah. And tell us about these lights. These are pretty cool. And they move
lights,
around,
our
right?
lights are new. They're really great, state-of-the-art lights. So they have function on the light itself and on the wall. So as the circulating RN, I'm the light person that's turning the lights on for the sterile people who can't use their hands to touch things. However, we would put like a cover over the light handles, and then we can adjust these sweet lights this way. Yeah.
That's amazing.
They can do a lot of cool things with that, and that's been a really cool thing. But if they can't adjust it, they'll say, hey, nurse, can you turn the light on or off? And that's my job, is to kind of go for all the things that they need that they can't get when they're sterile.
Absolutely. So, Abby, tell us a little bit about your work here in the OR.
Well, as a scrub tech, I feel like we are really behind the scenes. I didn't know what a scrub tech was until I talked to Brittany here, and she really got me into it. We pass the instruments, we advocate for the patient, which is probably the most important thing we do. We make sure everything around us is sterile, including like the doctors say they have a hole in their glove. I'd say stop, you need to change the gloves. I'd ask for the glove, and the circulator would grab it.
Okay.
So we do a lot of, we pass and we retract. We do a lot of the cleaning. So like we make sure the room's turned over for the next case and it is properly cleaned.
Yeah.
Make sure the instruments are properly cleaned. We do a lot of behind the scenes, but our job is very important.
So, Brittany, where are we now? What role does this room serve?
So this is the most important role in the whole process of surgery, I think. And it's the most behind the scenes. This is sterile processing. So for a surgery, you have to have clean instruments that have no germs, and they have to be sterilized.
Absolutely.
The sterilizer goes up to 272 degrees. That's how we get our instruments clean. And as you can see over here, we have one of our sterile processors going ahead to remove one of the racks full of clean instruments that are ready to go.
So how does this get them clean then?
So the instruments are cleaned after the surgery by hand, and then they go through a washing machine, like a dishwasher simply, and they come out through this area where it's clean. We inspect the instruments then and make sure that they're free of debris, of tissue and blood, and that they're properly cleaned. We then will wrap them in these blue wraps and then tape them. That special tape turns a different color when it gets to a certain temperature. So the instruments will go into the sterilizer or autoclave, and that will get up to a certain pressure and the 270 degrees or higher temperature for at
Wow.
least 4 minutes.
That's pretty hot.
4 minutes is considered the sterile, and that then will come down from temperature and it will alarm and we'll get it out, and then we let them sit and rest for up to 2 hours. That will get them down to a room temperature, and then we store them and they're ready to use when we're ready to do surgeries.
And what's going on over here?
Right here we have, this is how we wrap our instruments. So they're specially wrapped so that when you tuck in all the corners, the last piece that Jordan here will be putting together kind of tucks in. So then when she tapes it up and it gets sterilized, myself as like a nurse would open this for her, say she was scrubbed into a surgery. I'd be able to pull the top, pull the sides and open it this way. So nothing is touched on the inside and everything stays sterile, and that they can use it for surgery.
We are now in the family waiting room, or the quiet room. This is where family comes in and waits here when they're waiting to hear from the doctor. Can you tell us about that?
Correct. Yeah, so after your loved one goes back for surgery, you'll go back out to the main waiting room, cafeteria, wherever you would like in the hospital. And then once we have a pager system, once that pager goes off, this is where you'll wait for the doctor. So yes, we call it our quiet room. And then the doctor will come talk with you here. After that, you're free to go back out to the waiting room, cafeteria, while your loved one is in recovery, which typically takes about 30 to 45 minutes. Then at that point, you're welcome to come back to recovery with them.
So when the doctor comes and talks to you, I'm assuming that's the surgeon that operated on your family member, and they're kind of giving you an update on how it went?
Correct.
Okay.
Yep.
Okay, wonderful.
Yeah.
Well, this is a wonderful space. It's very cozy. We have some magazines, activity books to help the patient out, and it's just a nice, peaceful space during that time. That can involve some nerves, but I know that our surgeons are wonderful about really taking the time to be with those family members. So.
Yes, definitely.
Thank you so much for following along with our hospital rounds video. We featured surgery today. We saw pre-op. We talked to our nurse anesthetist, our RNs, our scrub nurse, and we saw sterile processing and OR. Thank you so much for joining us today. We hope that you enjoyed our little peek behind the scenes at Hillsdale Hospital Surgical Department, and we'll see you next time.